Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Naila Fadila Meka, and today I would like to give a presentation about a medical research article. The title of the article is Restrictive or Liberal Transfusion Strategy in Myocardial Infarction and Anemia. So in this presentation, I will explain how this article follows the Consort 2010 checklist. This checklist is used to check if a randomized clinical trial is reported clearly and completely. So I will explain what the Consort checklist is, then I will go through each part of the checklist. I will show if the article follows the rule or not. So about the Consort is short for Consolidated Standards of Reporting Trials. It has 25 items. These items help researchers report their study in a clear, honest, and useful way. The checklist is divided into 5 main parts: title and abstract, introduction, method, result, and discussion, and other details. So let's begin with the title. So the title should say that this is a randomized trial, but in this article, it does not say it clearly. There is small problem, but that doesn't mean that this article is not RCT. Okay, the abstract, however, is very good. It gives short but clear information about the trial, design and methods, the result, and the conclusion. So this is the abstract. It has background, methods, and results like that. The second is scientific backgrounds and explanation of rationale. So this is the introduction part. In the introduction, the article explains the background very well. It tells us that anemia is a common problem in heart attack patients. It also says why this study is important. So the goal or objective is clear. They want to find out if a liberal transfusion is better than a restrictive transfusion in heart attack patients with anemia. As we can see in here, specific objective or hypothesis. The primary objectives of the myocardial ischemia and transfusion armament trial was to determine whether the risk of death or myocardial infarction. Okay. Next is the description of trial design. So this is a method part. So this is the most important part of any research paper. First, the trial design is described. It was open label, a randomized trial done in 6 countries with more than 140 hospitals. But the point of 3B is not mentioned. This article is also mentioning the eligibility criteria for participants or who was included in this trial. The patient has to be adult with heart attack and low hemoglobin. As we can see here, we enrolled adults 18 years of age with ST segment elevation or non-ST segment elevation myocardial infarction. It means that the patient have to have anomaly in their cardia. And setting and locations where the data were collected is also mentioned. We conducted this open label randomized trial at 144 sites in the United States, Canada, France, Brazil, New Zealand, and Australia. Sorry. Okay, next, the intervention for each group are described in detail. In the restrictive group, transfusion was only given if the hemoglobin was under 8. And in the liberal group, the transfusion was given to keep hemoglobin above 10. Um, Next is the completely defined specified primary and secondary outcome measures, including how and when they were assessed. It means the outcomes are clear that mentioned in the article. The main outcome was death or another heart attack in 30 days. But the point 6b, any change to trial outcomes after the trial commenced with no reason, was not discussed. Next is how sample size was determined. The sample size was calculated. They needed 3,500 patients to see if there is a 20% difference between the two strategies. The randomization is done well. They use a web system and block design, which is a good method. Next, the method to use to generate the random allocation sequence. It mentioned a permuted block design with random block size of 4 and 6 stratified according to clinical site. And type of randomization, details of any restriction such as blocking and block size is as above. Okay, the ninth is mechanism used to implement the random allocation sequence, such as sequentially numbered containers, describing any steps taken to conceal the sequence until intervention were assigned. It mentioned in the paragraph by means of a web-based system. And who generated the random allocation sequence, who enrolled participants, and who assigned participants to interventions. It mentioned in here also the randomization sequence was created at the data coordinating center by an independent statistician. Okay, next. There was, if done, who was blinded after the assignment to intervention. There was no blinding. That means the doctors and patients knew which group they were in. This is a small weakness of the study because the patients knew. Next is description of the similarity of interventions are not addressed. Next is statistical method used to compare groups for primary and secondary outcomes. The statistics are strong. They use method called long binomial regression and also Kaplan-Meier analysis. They also explain how they handle the missing data. Okay, so now let's talk about the results. In the number 13A, for each group, the number of participants who were randomly assigned, it's mentioned a total of 3,504 patients who were studied, but only 57 were lost to follow up, which is very good. Next, 14.8, dates defining the periods of recruitment and follow-up. It mentioned here enrolled from April 2017 through April 2023, and 300 that is enough for the 14A. And the 14B, why the trial ended or was stopped, was not discussed. This article have a table shows the baseline characteristic, and the two groups were similar. So this is the table of the characteristic. Sorry if you cannot see it clearly. Okay, so the main finding of this article is that 16.9% in the restrictive group and 14.5% in the liberal group had heart attack or death. The risk ratio was 1.15, but the result was not statistically significant. The article also shows the harms transfusion reaction were rare. Fluid overload was more common in the liberal group. There are also subgroup analysis. For example, in type 1 heart attack, the liberal group did better. So, result of any other analysis performed, the effect of the restrictive as compared with the liberal transfusion strategy on the primary outcome was consistent across all pre-specified subgroups. And it shows all important harms or unintended effect in each group. Okay, next up is trial limitation, addressing sources of potential bias, imprecision, and if relevant, multiplicity of analysis. It mentioned in here. Our trial also has several limitations, as in all transfusion threshold trials. The assigned intervention was not masked from health professional caring for the patients, and the generalizability, external validity, applicability. If the trial findings, it was mentioned here, it was pragmatic, included a wide variety of older patients and representative of patients in clinical practice. Okay, so 22 is interpretation consistent with result. So this is the interpretation. A liberal transfusion strategy did not significantly reduce the risk of recurrent myocardial infarction or death at 30 days. That's the result. This article also have registration number and name of trial registry. It mentioned here, MIN, clinicaltrialsgrow.gov number, number NCT 029814007. Okay, next up, where the full trial protocol can be accessed. It have the address, I think the link address here mention it, sorry. And the last is source of funding and other support is also mentioned here. Supported by grants from the National Heart, Lung, and Blood Institute. Okay, I think that's it from me. Sorry for all of my mistake, and thank you. Wassalamualaikum warahmatullahi wabarakatuh.